Welcome to this introduction to the National Dementia Workforce Study Survey Questionnaires. I'm Joanne Spetz, lead of the questionnaire design team, and in this video, I will walk you through the survey questionnaires. The National Dementia Workforce Study was solicited through a request for applications from the National Institute on Aging. The overarching goal is to answer questions about the workforce that serves people living with dementia and the impact of that workforce on the outcomes for the people they serve. Through a cooperative agreement with the National Institute on Aging, we are conducting the first large annual surveys of the paid dementia care workforce in the United States. The survey data will be linked with other data sources, and all of the data will be available to researchers at no cost. In designing this study, we began with the question of where people living with dementia receive care. 4 of the most common sources of care are clinicians, including physicians, nurse practitioners, and physician assistants, and the people who work in their offices. Nursing homes are a location where a very large percentage of residents have dementia, and so these are very important. Assisted living communities are growing very rapidly. About 18% of these have a dementia care unit, and it's been estimated that 42% of assisted living community residents have dementia. Home care agencies and home health agencies also are important settings of care. Of course, there are many other sources of care for people living with dementia. Family members and other care partners are particularly important, and we will explore their relationships with paid workers in this study. So let's talk about the paid workforce in these common settings of care for people living with dementia. In clinician offices, most of the care is coming from primary care providers, along with clinicians who have specific training and expertise in caring for people living with dementia. In nursing homes, assistants and aides are more than 1/3 of the workforce, and licensed nurses are more than 20%. In assisted living communities, more than 40% of the workforce is aides and assistants, alongside some licensed nurses, recreation and activity staff, and other professionals. Finally, in home health and personal care agencies, more than 60% of the staff are aides and assistants, and licensed nurses are more than 15%. We selected our survey populations based on these data. The NDWS consists of a family of 4 surveys: community clinicians, nursing home staff, assisted living staff, and home health and home care staff. For the staff surveys, we are focusing on licensed nurses and direct care workers. Plus, we are surveying the administrators of nursing homes, assisted living communities, and home health and home care agencies in which the staff work. Our survey team includes experts in care for people living with dementia in primary care, neurology, geriatrics, psychiatry, nursing homes, assisted living communities, and home care, as well as experts in occupational health, cultural diversity and humility, sociology, economics, and other fields. We developed the questionnaires in the context of a review of the related literature and questionnaires that have been used in other studies. We also issued an invitation for researchers, people in the dementia care workforce, and others to submit ideas for survey content. This will be done every year to add some new exploratory questions and modules, some of which might become permanent. Our survey team met as a large group and in subgroups to select and develop questions with a lot of iteration and revision. We also engaged 6 consultants and the scientific officer from NIA, Priscilla Novak, in the development of the questionnaires and in the reviewing of the draft questionnaires. All of the questionnaires underwent cognitive testing with people employed in the types of jobs for which the questionnaires were designed. This led to more refinement of the surveys. And finally, all of the staff questionnaires have been translated to Spanish. Now I'll walk you through the key survey content domains in the Year 1 questionnaires. I'll begin by describing the staff questionnaires, and then I'll walk you through the clinician questionnaires. The education and training questions consider both formal training and informal training of staff. We ask them about current and past state licenses, certifications, and registrations. We also ask if they are now enrolled in any education program and their highest level of education. There are questions about formal and informal training in topics relevant and specific to long-term care and dementia care. And we ask them to what degree their training prepared them for what it's like to actually work in their job. We have many questions about employment in the questionnaires for staff. They are asked about their experience in long-term care in general and about their tenure with their current employer. Regarding their current employment, they are asked about the number of jobs they hold and descriptions of these jobs. And for the employer through which we obtained their contact information, we are asked about their hours per week, their shifts, and the stability of their work schedule. We ask staff about their wages and their employment benefits, and there are questions about their modes of community and the reliability of their transportation to work. For home health and personal care staff, we also ask some additional questions, including how many clients they serve, whether they live with their client, whether they travel between clients and how they do so, and other topics. After asking about the general characteristics of employment settings, staff are asked about their practice, attitudes, and working conditions. They're asked whether they specialize in dementia care and how stable their resident and client assignments are. They are asked whether they administer medications and what types, because we know that some states and some employers restrict direct care staff from this service. We use 2 validated scales to measure attitudes about people living with dementia and staff's sense of competence in dementia care. And we ask about the support that staff receive in grieving, their access to supportive and protective equipment and help, the degree to which they believe that their management prioritizes their safety, and the degree to which they believe that their job might interfere with their personal life. We ask about numerous worker outcomes, including job satisfaction with 17 items, burnout, intention to quit their job, having enough time to do their job well, communication and team engagement questions, experiences of disrespectful behaviors from other staff and from clients and residents, their perceptions of discrimination in the job, and work-related injuries. Finally, we ask them whether they'd recommend their facility or agency to their family or friends. Now let's turn to the clinician surveys. For clinicians, we ask about their licensure, education, fellowship training, and national certification. These questions are somewhat different for each of physicians, nurse practitioners, and physician assistants. We also ask clinicians about the degree to which their formal training prepared them to provide care for people with dementia. Clinicians are asked many questions about their practice setting. They are asked how many clinical positions they hold and for information about those positions. For their principal positions, they are asked to describe the practice setting, including whether they perceive it to be in an underserved community, and they're asked how long they've been in that practice. They're asked about how much they work and how they allocate their time. They're asked about their patient volume and some other characteristics of the practice, such as the functions of their electronic health record and the modes of medical interpretation available. Clinicians are asked many questions about their own practice, specifically as it relates to dementia care. They're asked about their patient panel size and the characteristics of their panel. They then are asked about the provision of cognitive assessments in their practice, including frequency and who administers the assessments. They're asked about their confidence in diagnosing types of dementia and their referrals for diagnosis. There are questions about their sense of the degree to which specific medications, tests, and referrals should be prioritized and the degree to which they do these things. The questions include referral for social needs and ask about their familiarity with community resources to support people living with dementia. Finally, clinicians are asked about factors that interfere with their ability to provide high-quality care, such as their patients lacking financial resources. Clinicians are asked 3 questions related to their outcomes: job satisfaction regarding 9 items, burnout, and their intention to quit their current practice. The same set of demographic questions are asked of all survey respondents at the end of the questionnaires. These questions include birth year, race and ethnicity, immigration status, citizenship, concerns about deportation risk for themselves or family, sexual and gender orientation, veteran status, languages other than English that they speak, whether they identify as a person with a disability, how many children and adults live in their home, and the care needs that they might have in home for adults who have a disability. The administrator surveys are completed by each organization participating in the staff surveys. These questionnaires include items about the facility or agency setting and its characteristics, such as its size, whether it is a nonprofit or for-profit organization, its management's turnover, and association with other long-term care organizations, such as being in a chain. The administrators are asked about the benefits they offer to staff and which staff categories are represented by a union. And they are asked about dementia-specific care as part of their hiring, training, and ongoing education. You can download the questionnaires and learn more about the National Dementia Workforce Study at our website. We look forward to seeing the great research that you will conduct with these data.